A guide for first-time parents. You've no doubt been dreaming about your newborn baby for months. What they'll look like, what they'll sound like, and even what they'll feel like. But no matter how much you've prepared, you'll likely welcome tips for taking care of a newborn, especially if it's your first child. Life has changed now that your baby is here, and you might have lots of questions about what to do. These tips can help first-time parents feel confident about caring for a newborn in no time. How do you get help after your baby comes home? An important part of caring for a newborn is to also take care of yourself. Consider getting help during this time, which can feel hectic and a bit overwhelming. Even when you think you've got it covered, don't hesitate to ask for a hand. Communicating our needs can be difficult at any stage of life, and it certainly doesn't get easier after a baby arrives. Parenting your new little one requires extreme amounts of energy and fortitude. And it's absolutely okay if you're not able to muster them at the moment. Relatives and friends might want to help. Even if you disagree on some things, their own experiences might be helpful. To keep your baby healthy, anyone handling your little one should be up to date on their vaccines and help only if they feel well. But if you don't feel up to having guests or have other concerns, don't feel guilty about limiting visitors. How do you handle your baby? If you haven't spent a lot of time around newborns, they may seem very fragile. Here are a few basics to remember. Wash your hands or use a hand sanitizer before handling your baby. A newborn's immune system is not strong yet, and you do not want to pass on any germs or infections. If you have visitors or guests, make sure they wash their hands before handling the newborn. Support your baby's head and neck. Cradle the head when carrying your baby, and support the head when carrying the baby upright or when you lay your baby down. Scoop and bring the baby close to your body. It is important that you always support the head and neck because newborns do not have strong neck muscles. Never shake your baby, whether in play or in frustration. Shaking can cause bleeding in the brain and sometimes death. If you need to wake your baby, don't do it by shaking. Instead, tickle your baby's feet or blow gently on a cheek. Always fasten your baby securely when using a carrier, stroller, or car seat. Limit any activity that could be too rough or bouncy. Avoid rough play with newborns, such as jiggling them on the knee or throwing them in the air. How do you diaper your baby? Changing diapers is often a source of dread, fear, and humor for new parents and caregivers. Whether you use cloth or disposable diapers, your little one will dirty them about 10 times a day, which is about 70 times a week. When diapering your baby, have all the supplies you need within reach. It can be useful to ensure that you create a place in the living room where you can change your baby and where you have all your belongings. It helps to have everything prepared and within reach before you start, so you don't have to leave the baby to grab anything. Starting with a changing pad, diapers, and wipes. This saves a lot of trips to the baby's bedroom. Wipe your baby front to back gently using water, cotton balls, and a washcloth or wipes. Cleaning is important to prevent bacterial infections. To clean poop, you'll probably need several wipes to ensure the baby is clean. Gently lift your baby's legs by the ankles and wipe in between the baby's buttocks. Air dry the skin for a moment. You can prevent diaper rash by keeping your baby's bottom clean and dry. Give their bottom a few seconds to dry out before you put on the clean diaper. Apply diaper cream. If your baby has a rash, apply diaper cream or petroleum jelly before you put the new diaper on. Wash your hands after changing the diaper. If you are wearing gloves, remove and dispose of them. Then, wash your hands with warm water and antibacterial soap. When should you bathe your baby? Few things are more nerve-wracking than bathing a newborn. Not only can they feel impossibly fragile, you may worry about whether they're warm or comfortable enough, and if you're doing a sufficiently thorough job. For the first few weeks, babies get sponge baths. Then, after the umbilical cord stump falls off and the circumcision heals, if your baby was circumcised, once they no longer have their umbilical stump, you can begin giving them more traditional baths, and they can have baths in a small plastic infant tub. When your baby is ready for tub baths, the first ones should be gentle and brief. If your baby gets upset, go back to sponge baths for a week or two, then try the tub bath again. A bath 2 or 3 times a week in the first year is fine. More frequent bathing may dry the baby's skin. How often should you feed your baby? Every baby may get hungry on their own unique schedule. Most infants in the first months of life will eat every 2-3 hours, depending if they are nursing or drinking formula. Whether feeding your newborn by breast or a bottle, you may wonder how often to do so. Generally, it's recommended that babies be fed on demand, that is, whenever they seem hungry. Your baby may show you they're hungry by crying, putting fingers in their mouth, or making sucking noises. A newborn baby needs to be fed every 2 to 3 hours. As your baby gets older, their stomach stretches and grows. Every baby is unique, but one thing that's pretty consistent is that breastfed babies eat more frequently than bottle-fed ones. That's because breast milk is easily digested and empties from the stomach a lot quicker than formula. Breastfed babies are probably getting enough to eat if they seem satisfied, have about 6 wet diapers and several poops a day, sleep well, gain weight regularly. Another good way to tell if a breastfed baby is getting milk is to notice if your breasts feel full before feeding your baby and less full after feeding. If you're formula feeding, you can easily see if your baby is getting enough to eat. Talk with your doctor if you have concerns about your baby's growth or feeding schedule. Babies often swallow air during feedings, which can make them fussy. To help prevent this, burp your baby often. For both breastfed and bottle-fed babies, don't give liquids other than formula or breast milk to babies under a year old. That includes juices and cow's milk. They don't provide the right nutrients and can be upsetting to your baby's tummy. What should you know about your baby's sleep? Just as with adults, babies and children's sleep patterns vary. From birth, some babies need more or less sleep than others. You may be surprised to learn that newborns sleep about 16 hours or more. Most newborn babies are asleep more than they are awake. Their total daily sleep varies. They typically sleep for periods of 2 to 4 hours. As your baby grows, they'll need fewer night feeds and will be able to sleep for longer. Many babies sleep through the night, between 6 to 8 hours, at 3 months of age. But if yours doesn't, it's not a cause for concern. Like adults, babies develop their own sleep patterns and cycles. Always place babies on their back to sleep to lower their risk of SIDS. Other safe sleeping practices include not using blankets, quilts, sheepskins, bumpers, stuffed animals, or pillows in the crib or bassinet because they can suffocate a baby. Parents sharing a bedroom, but not a bed, with the baby for the first 6 months to 1 year. Change the position of your baby's head from night to night, first right, then left, and so on. This helps prevent a flat spot from developing on one side of the head. Before long, you'll have a routine and be parenting like a pro. If you have questions or concerns, talk with your doctor. They can recommend resources that can help. So that was all for today's video. We hope you like the video and our tips will help you in your parenting. For more videos like this, do subscribe to our channel and please leave a like to show us that our tips help you. See you next time.